Today we're out at the Golden Jubilee, the National Waiting Times Hospital. My name is Ros Moore and I'm the Chief Nursing Officer for Scotland. I'm also the Director for Patients, Public and the Professions at Scottish Government. My directorate has professional leadership responsibility for nurses, midwives, the allied health professions, healthcare scientists, as well as the assistive staff that work within those teams. I advise Scottish Government on anything to do with nursing, midwifery and the allied health professions. I have a team and other chief officers that support me in doing that, but I'm the person who offers the ministers any advice that they need around those things. I spend at least 2 days every month in one of the boards, going to visit different centres, talking to the staff, talking to patients, getting some feedback, asking them what's important to them, what they'd like to see coming down, those sorts of things. The healthcare system's always been patient-focused, but that's not the same as person-centred.
It's raised people's awareness and it's turned the thought processes around, and it's much more about a person than a patient. So I think even making that leap, if that was the only thing that ever came from it, then I think that's a fantastic thing to have achieved.
There is still that nurse, that traditional nurse that works within a hospital caring for the very sick, but a large part of the profession works in health visiting, school nursing, in district nursing, in practice nursing, and in various roles that are very different, that do involve some care, but are much more geared towards empowering and enabling and working with the person to help the person live the life they want to lead rather than telling them how to live their life. What are the outcomes that we are supporting the person themselves to achieve? That might be going to the shop, it might be phoning their children, it might be able to walk up a mountain. Very often those are the outcomes that patients have that are very different from clinical outcomes, and we have to begin to work towards those as passionately as we work towards the clinical outcomes that we all strive to achieve as well. In terms of the system as a whole, we have to move, I think, to a place where the NHS operates on and for the people that it serves. And that will shift the organisation, the way that we do things, the way that buildings are used, the way people work, 24-hour day working, things like that. You know when an organisation is built around you as a customer in every other sphere of the world.
This is our contact centre, and we've got a few boards. Nurses are working here and they're answering calls. And even in hours when the doctors are opened, we're still getting calls because patients want information.
Yes, they do.
They want advice.
No, not at all. Okay, so is that the full 3 days as well, or is that just last night?
So much more than an out-of-hours service.
Oh, much more. It's expanding in every direction. But it's really, and obviously with our future programme, we're looking at the way we deliver our service. Can we do it better? And I think we can. I think there's lots of room for improvement, and we're seeking always to improve.
Well, that's always been a culture. I have an aspiration, along with my fellow directors, that the NHS in Scotland is world class in every single way, and that it's renowned throughout the world for the quality of its care. It's safe, effective and person-centred care, but it's also renowned throughout the world for the quality of its practitioners, for the quality of its nurses, for the quality of its midwives, for the quality of its nurse education and the quality of its midwifery education. We live in times at the moment where resources are more limited, whilst demand for healthcare continues to grow exponentially, really, as people live longer and more fulfilled lives. Education is absolutely at the heart of creating a workforce that's able to meet and work in that world. In order to prepare Scotland for the future and to have those practitioners we want to see, those caring, compassionate, technically and academically competent practitioners who are great team workers, who can work in enabling, empowering, co-productive manners, I think we've got to look at our education system and make sure that that's right. So the CNO's review is about that, a good quality education system that will create the best practitioners we can for Scotland and that are fit for the future. I see extraordinary every day. I do see extraordinary every day. That's why the title, I think, is so compelling. I am awed every single day by the fabulous nursing and nursing leadership that I see in Scotland. I could probably do a year-long DVD quoting all the things that I see.